Hi, this is Dr. Sara Sabokpey at Comfy Dental Studios. Today I wanted to talk about dental inlays and onlays. Been getting a lot of questions from patients who have cavities that need repaired, which are too big for a filling and they don't necessarily need a crown. And patients ask us a lot of questions about inlays and onlays, so I wanted to address those. What are inlays and onlays? Inlays are restorations that are smaller. They go in between the teeth, on top of the teeth, and they restore the areas that were damaged and lost from a cavity, but they are bigger than a regular filling that we put in at the office. Onlays, however, are bigger. They go on top of the teeth on where the humps and the cusps of the teeth were. If we have damaged cusps that we need to remove, or if they're undermined, thin, that we think they're going to break, we're going to remove those and replace them with an onlay that go on top of the tooth, and they are chemically bonded to the tooth. The difference between an inlay and an onlay is that an inlay goes inside the tooth. It does not cover the cusps or the humps of the tooth. The onlay, however, covers one or more cusps and humps. Inlays and onlays are different from a regular filling because they are lab made. They are not as aggressive as a crown, but they are still lab made and they are made from ceramic material. Although we do have new filling materials that are also ceramic, but filling materials are done in the office and they are cured in the office and that you leave with your restoration. Inlays and onlays, however, require temporary material before we get the final restoration from the lab to place on your tooth. Inlays and onlays are different from a regular crown by how many surfaces they actually cover. A crown goes around the tooth and on top of the tooth, so it covers the whole circumference of the tooth, whereas inlays and onlays are either inside, in where the valleys of the tooth are, or they cover the humps and the valleys. So crowns are all around the tooth, but inlays and onlays do not cover all the surfaces of the tooth. Sometimes we recommend inlays and onlays instead of fillings and crowns. Inlays can replace a filling if the filling is getting too big for the material to be able to withstand the forces. We recommend doing inlays versus fillings. Now, if the damage to the tooth is large enough that needs an onlay and it is damaging the humps of the tooth and the cusps of the tooth, we recommend onlays. But if there is more damage to the tooth where an inlay and an onlay are not sufficient, then we will have to do a dental crown, which goes all around the tooth to cover all the surfaces. And that is if the damage is on all the surfaces of the tooth, or if we need coverage on more surfaces than an inlay and an onlay can cover. Inlays and onlays are made of ceramic materials or sometimes gold materials. Those are the two materials we use in our office for inlays and onlays. Inlays and onlays are easily matched to the natural teeth around them to make sure that they fit seamlessly within your smile. Getting an inlay or an onlay is not a painful process. It is like any other dental process, and we use local anesthetics to make sure our patients are comfortable and pain-free throughout the process. To get an inlay or an onlay, you require 2 appointments. In the first appointment, we prepare the tooth for the restoration, which is an inlay or an onlay. And then on the next appointment, we deliver and cement or bond the inlay or an onlay on the tooth. The process at each appointment for getting an inlay and an onlay is the first appointment, we bring our patients in, we go through our regular process of the meditation, and then we start with numbing the tooth and then taking an impression of the tooth prior to doing any kind of restoration on it. And then we prepare the tooth for an inlay or an onlay. And then we provide a temporary for the patient to go home with. And when the patient comes back on the second appointment, if needed, we numb the patient again and we place the inlay and onlay. If it's gold, we have to cement it. If it is a ceramic material, we will be bonding it to the tooth. Like any other restorative material or processes, inlays and onlays can last a long time. We need to make sure that our patients are compliant at home, doing their cleanings on a regular basis, and also taking care of their teeth and their restorations. So, no hard, chewy materials, nothing that can take them out, and nothing that can break them. Inlays and onlays are stronger and harder than regular filling materials, and that's when they are required, and that's when we recommend them when we know that filling materials cannot withstand all the forces. Inlays and onlays can help preserve more of your natural tooth structure compared to crowns. So they are less aggressive than crowns. The special care that's required after getting an inlay or an onlay is to make sure that you don't chew anything crunchy or anything hard on that tooth so that you don't break or fracture any part of the restoration or even your own tooth. Also, you don't want to have anything super chewy because it could also take out your inlays, onlays, or debond them. We also do recommend that patients who are heavy clenchers and grinders wear night guards to protect their inlays and onlays. Inlays and onlays can fall out and need to be replaced or re-cemented. The time that inlays and onlays can be debonded if there was any contamination in the bonding process, or if the inlay and onlay have some cavities underneath where they couldn't bond well too. A lot of dental insurances do cover some of the cost of inlays and onlays. So we would have to consult with your insurance provider to determine what your benefits cover. If you want to find out if you need an inlay or an onlay, my recommendation is to come in for a consult or come in for an exam to see what your requirements are. If you want to know if you need an inlay or an onlay, my recommendation is to come in for an exam or a consult to see what the recommendations are for your specific needs. I hope I've answered all of your questions today. If there are any other questions or if you would like to make an appointment with us at Comfy Dental Studios, please call us at 310-499-2048.